morning, Amber. My
Hi.
name's Lonnie. I'll be doing your interview today. Thank you for coming in. Nice to meet you too. Okay, well, I guess we'll just go ahead and get started.
Okay, here's a copy of my resume.
Perfect, thank you. And you have your pen and paper in case you need to write anything down.
I do.
All right, so do you want to tell me why you chose pharmacy technician as a career?
Well, I've always loved working with customers or patients, and the pharmacy allows me to work in healthcare, which I really like learning about. And patients are great.
All right, thanks. Now, how do you think you would handle a difficult customer?
Well, I think that it would be important to get down to why they're angry and then try to figure out how you can fix it. So it's just about deflating the situation.
Why do you want to work at this pharmacy?
I've heard great things about this pharmacy just from working at other pharmacies. Patients and even pharmacists have the utmost respect for this pharmacy, and you guys offer a lot of programs that aren't available at other pharmacies. Like your foot care program is wonderful. Heard so much about it.
Okay, thank you. Anything else?
No, I think that's about it.
And what is one of your strengths?
I am highly organized, and I love to have everything in its place. I love to keep things clean. I think it's a really good thing to have in pharmacy because everything needs to be organized at all times or you have chaos.
How would your coworkers describe you?
Friendly and upbeat. I have great communication skills.
And why should we hire you?
Well, I think I would be an excellent member of your team. I'm so sorry, I'll forget this word. I would be a great member of your team because I can work with everyone really well. I would know I could do any of the places in a workflow situation that you have set up, like data entry or filling or checking or anything like that. I'm really good at working on my own. So if I need to spend, 9 hours doing blister checks, I can do that.
Can you tell me the difference between prescription medication and over-the-counter drugs?
Okay, so over-the-counter drugs are available for sale in a pharmacy. They have to be within 10 meters, 10 feet of the pharmacist, and they're available for anyone to pick up at any time. And the pharmacist is there to counsel if they have questions, and we can help them find them if they need to. And prescription medications is needed from a physician or someone who is qualified to write prescriptions to get a medication that needs to be monitored.
Perfect, thanks. And tell me about your experience in the pharmacy industry.
Sure. I've worked at a couple pharmacies now, and I've also done a placement at a pharmacy. So I've been doing it now for a few years. I worked mainly in community pharmacies, but have had a placement at the hospital here in Peterborough for 4 weeks, where I learned sterile compounding and prep, which was interesting. In community, I find that it's more about the individual patients and working with our community to find spots for them all if they need support.
Are you willing to complete continuing educational courses?
Yes, we do that already as part of our OCP portfolio. We're continuously doing educational programs and readings about new things that are coming out in the pharmacy.
Mm-hmm. Okay, and what is one weakness?
Well, I'm not a very good public speaker, but I have been taking classes at the Learning Annex to try and work on my skills because it's hard when you have those flaws, and they tell you how to work around them so that it's not a problem.
That's great. Thank you.
Thank you so much for meeting with me.
You're
I
welcome.
appreciate your time.
Thank you for coming in.
Thank
Look forward to
Bye.
seeing you again.